Hi friends! If you haven't already seen any of my videos, my name is JT and I'm doing these videos as part of a class project for my senior capstone. And this video is going to be about medical transition. Everything about medical transition, ethical debates about medical transition, and so yeah, let's go ahead and get started. First and foremost, I really want to take a second to define exactly what gender-affirming medical transition actually is. This is just really medical interventions that are used to help a person match their physical body to their internal gender identity. And medical transition really does come in two major forms, which is hormone replacement therapy, or HRT, and surgeries. The Human Rights Campaign does have really good definitions of everything trans related, so I'm going to be pulling those definitions directly from that site, and I'll read those now. Hormone replacement therapy medications are prescription medications that are synthetic versions of the testosterone or estrogen, the same hormones that naturally develop at various levels in cisgender men and cisgender women. Essentially what's happening is you are replacing the hormones in your body that your body naturally makes with the hormones that the other sex makes. And gender-affirming surgery includes a wide range of procedures, such as plastic surgery to change features in the face to more typically masculine or feminine, top surgery to make changes to the chest or torso, and bottom surgery to make any changes to a person's genitals. We'll definitely get more into all of that and more of what it means and what it does, but for now, I just wanted to give the basic definition to start off the video. In terms of what medical transition actually looks like for a trans person, everybody's medical transition is really going to be different. I know I've said that 1,000 times in this series, and I guess that's the main takeaway, right? Every single trans person is completely different. Many people have the misconception that transition really does follow a single path, which is, okay, the person socially transitions, they start hormones, they do top surgery, they do bottom surgery, boom, the transition's complete. But that's actually not how a lot of people go about their transition. And that's mainly because each person's body is going to react completely differently to the medical interventions that they take. So just for example, like on hormone replacement therapy for a trans woman, some people may develop breasts, other people may not. Usually somebody that's on estrogen will develop some sort of breasts, but obviously genetics are going to factor. So some people might not want to get top surgery at all or breast augmentation because that's not something that they need, whereas that might be another person's complete focus on something that they want to do. On top of this, it really just can depend on a person's personal preference. Some people just don't want to do a certain surgery, and there's nothing requiring any trans person to do any certain surgery in order to be trans. So it really just boils down to what people want to do with their body. And some people may follow that more stereotypical path to what medical transition looks like, to what I described, but again, everybody has their own bodily autonomy, so it's going to be different. So what bodily changes happen when you do transition medically? Again and again and again, everybody's going to be different and nobody's body is going to react the same to each medical intervention. But the first big factor to changing a person's physical body is hormones, and this is what most doctors will recommend that a person does first. This is what I'm most excited to talk about, is hormones, because I feel like a lot of people just have no idea what they actually do or the changes that they can have for a person, especially over an extended period of time. There are so many changes that can happen that I can't keep it all straight in my head, so I'm going to read it off the screen here. This is just some of the stuff that can happen. So on HRT, a trans woman, it looks like taking estradiol, which is a synthetic form of estrogen, and then you also take an androgen inhibitor, which kind of blocks the testosterone production in your body. And in no particular order, here are the effects that estrogen can have on a trans woman. It can soften and smooth your skin, cause breast growth, with some exceptions, but most trans women will experience breast growth on hormones, change in hair texture and thickness, changes in your fat distribution. You can get wider hips, bigger butt, facial changes as the fat moves around. It can slow and lessen body hair growth, decrease sex drive, lighten your eye color, make your hands and feet slightly smaller, change hip bone geometry depending on when you start hormone replacement therapy. Usually the younger you start it, the more likely you are to experience more drastic changes. Decrease or change in body odor, decrease in testicular size and atrophy of the penis, and drastic decrease in muscle mass. For trans men, you're actually going to see a lot of the opposite effects, like I've mentioned in previous videos. And for trans men, going on HRT looks like taking testosterone. Usually that's in the form of an injection or like a gel. Those effects include making your skin texture rougher, changing hair texture, and it can cause your hair to thin out more. It also changes your fat distribution, but it changes it to different areas. So for example, your stomach, your shoulders, and your face, and it kind of changes to where a cisgender man's body tends to hold fat. It can heavily increase body hair, including facial hair, again stimulate that facial hair growth. It can increase sex drive, darken your eye color, make your hands and feet slightly larger, increase or change body odor, increase the size of the clitoris, which is called bottom growth, drastic increase in muscle mass, but most notably for trans men, one of the things that happens that especially helps trans men pass really well is that testosterone actually changes your voice. It drops your voice down low where a cisgender man's usually is, and that is something that is really different compared to trans women because estrogen has no effect on a person's voice at all. So I am very jealous of you trans men for getting that vocal change, but also happy for you. And this is just a list of the typical changes that can happen. There are also some anecdotal pieces of evidence that people experience like a heightened sense of smell on estrogen, much different emotional and psychological changes, and some trans women have experienced period-like symptoms. And let me just be clear, trans women cannot menstruate. There's no bleeding, there's no uterus to bleed, but you can still experience some of the hormonal effects of a menstrual cycle, like becoming especially emotional during certain times. Some trans women have even experienced cramping in the lower stomach, which is really interesting. There haven't been extensive studies on those different effects, but many trans women do experience them. So moving on to gender-affirming surgeries, there really are three main categories, which are facial reconstruction, top surgery, and bottom surgery, as I mentioned earlier. One that is less talked about is the facial reconstruction. This really just means that trans people can opt to have a wide variety of plastic surgeries or facial reconstruction surgeries in order to achieve characteristics on their face or other parts of their body that more resemble a cisgender person. Some of the most common gender-affirming procedures would be hairline lowering, brow bone reduction, brow lifts, forehead contouring, under eye filler. You could get a rhinoplasty, which is just more commonly known as a nose job, cheek filler, lip lift, lip filler. You could get jaw or chin implants. You can also get jaw or chin contouring and a trachea shave. And that's just some of the procedures that you can have. Typically with trans women, it's referred to as FFS, which is facial feminization surgery, and they opt to get many of these surgeries at once for a more drastic change in their appearance. Next, we have top surgery, which again is alterations made to the chest or torso. Typically for trans men, this is going to look like a double mastectomy, where both breasts are removed from the body. And for trans women, it's usually going to be a breast augmentation, where there are implants added to the breasts to make the appearance larger. Top surgery is usually the most simple, but then we have bottom surgery as well, which is any effort to change a trans person's genitals through surgical measures. For trans women, this can be an orchiectomy, a vaginoplasty, or a vulvoplasty. Orchiectomy and vaginoplasty are probably the most common. An orchiectomy is when a trans woman has the testicles removed, but everything else stays the same. A vaginoplasty is when a trans woman's existing genitalia is basically rearranged to be a functional vagina in terms of sexual intercourse and going to the bathroom, basically. That is done through multiple methods. Usually the most common is like penile inversion, where they really kind of just do flip everything inside out and you have a functioning vaginal canal. The last option is a vulvoplasty, which is less common, I believe, but a lot of trans women still may opt for this. And basically what happens is they use parts and pieces of the existing genitalia to turn it into a vulva. So you really only get the outward appearance of female genitalia, but there is no functioning vaginal canal. So which surgery somebody gets is really just depending on factors like recovery time or what they're trying to achieve. Like if they don't really care to have sexual intercourse, but they really want to have the look of a vagina, a vulvoplasty is going to be the clear option. For trans men, it really can be a metoidioplasty, a phalloplasty, or a hysterectomy. Usually the hysterectomy comes along with either of the other two bottom surgeries. So a phalloplasty is pretty common. That is when they take skin from another part of the body to create a penis. So usually if you see a trans man that has like a scar on their arm, that like where they've taken a skin graft, that usually means that they've had a phalloplasty, and they pretty much get a fully functional penis out of that. The next one is metoidioplasty, which a metoidioplasty is when they reconstruct the clitoris to more resemble a penis, and a hysterectomy usually goes along with both of those, and that's just the removal of the uterus. And so that is something that prevents periods in the future from happening. Experiencing a period cycle for a trans man can be something that's dysphoria inducing, so many trans men may opt to get their uterus removed. If a trans man wants more length in their genitalia, a phalloplasty is going to be a better option for them because the metoidioplasty does tend to have less of a lengthening result. I do want to point out the naming of top and bottom surgery. Obviously, top surgery, bottom surgery, so that's pretty self-explanatory. But it's also used to make the language less gendered and more versatile, because top and bottom surgery refers to both trans men and trans women. But saying breast surgery is gendered. That makes you think of a gendered part of the body. Many doctors tend to avoid that language. So the facial reconstruction, the top surgery, and the bottom surgery are the most widely known ones, but there are other procedures that you can have to alter other parts of the body that you may be dysphoric about, and that includes things like hip contouring or silicone injections in different parts of your body, or you could opt to get something like vocal feminization surgery, which is a surgery on the vocal cords that makes your voice sound more masculine or feminine. And again, with trans women not having any change in their vocals from estrogen, this may be something that a lot of trans women opt to do. Something else that is important to note is that usually hormones or any sort of bottom surgery directly leads to infertility. So a person will no longer be able to produce their own biological children if they go through with the procedures. And you can, if you're a trans woman, you can freeze your sperm in order to keep that functionality. And for trans men, it's the same with having preservation options for the egg. We will talk more about the reversal side of things later in the video, but just know for now that if a person goes off of hormones, most likely their fertility will come back. But again, there's been limited studies on this, so there could be complications where the infertility is permanent. It just depends on the person. Many people refer to going on hormones as going through a second puberty if a person was past the age of 18 when they started hormones. They say this because there is a lot of parallels to going through the first puberty. So I want to talk about what it actually feels like to go through a second puberty as an adult. Fortunately or unfortunately, it can kind of be just as confusing and emotional as the first puberty because your body's going through a lot of changes and your hormones are shifting and they're completely different from what they've ever been before. So there's definitely going to be a lot of adjustment period in getting used to your new emotions and psychological state. And although your body is changing in a way that is favorable this time, it's still a time when you can say, well, is what I'm experiencing right now normal? Is this an intended effect of the hormones? Am I an outlier? Is something going wrong? And also just the added anxiety of like, how will my body change? It's even more pronounced as an adult because you fully understand what that means as your body changes, and there's an understanding that, oh, I may not know what my body will look like in 1 year. And that can kind of be exciting, but also anxiety inducing for some. And if you're going through this second puberty as an adult, the one thing that is really different is like there's no strong sense of embarrassment or awkwardness at the same level that there is during the first puberty. Again, because it's a puberty that you've actually wanted your body to go through, and also because you've just had more life experience and you know that your body changing isn't the biggest thing in the world like it is when you're 14. Something interesting that I've experienced on hormones for 5.5 months now is definitely the emotional changes are very significant. I like cry a lot now, which is interesting because I was never really a crier before. It can actually be quite unpredictable, which is something that is interesting. There's been times where I'm like crying and I'm like, why am I crying so much? And I don't even understand why. That may sound distressing, but it's actually kind of nice because it makes me feel more in touch with the emotions that I'm having. And I'm more easily able to recognize when I'm feeling sad or upset or stressed, where that was something I really struggled with before going on estrogen. So that's been a really positive change. And I'm not alone in that experience. A lot of trans women experience some sort of heightened emotionality, whether that's like sadness or an overall deeper feeling of all your emotions. And something interesting is that a lot of trans men describe this much higher sex drive with also a feeling of anger or just being more quick to anger. That goes to show that the hormones in our body do play such a big role in how we're actually feeling and how we're experiencing the world. If you do have extra time, I would recommend like looking up the little niche changes that can happen on hormones because it is really interesting. Like something that a lot of people don't think about is like your blood vessel dilation is different on estrogen, and so you tend to be more hot or cold depending on the environment. I know I struggle to take as hot of showers as I did before. Next, I want to move on to how much medical transition costs, and the short answer is so much money. I found this chart from genderconfirmation.com, and I'll put that on the screen as I'm talking, but as you can see, the prices for these surgeries are pretty insane. And let's just take a trans woman, for example. If a trans woman wanted a breast augmentation, full facial feminization surgery, a vaginoplasty, and vocal feminization surgery, that's going to range anywhere from $62,000 to $164,000, depending on the surgeon that you go to, which is the price of a house in some areas of the country. And this is a good base list of prices, but again, there could be other surgeries that aren't listed on here that may have more varying price ranges. For example, I mentioned vocal feminization surgery. I recently just got a quote from a surgeon, a good surgeon, who was charging around $11,500 base. So that's also quite expensive. It's no wonder that a person's socioeconomic status is a factor in somebody being able to afford transition because the surgical transition is so extremely expensive. Not every trans person is going to have the financial resources to be able to make the changes to their body that they want to. And even something like the hormones for HRT, those monthly costs can really start to add up, especially if you're somebody that is living paycheck to paycheck. I do injectable estrogen once weekly, and my 3-month supply of that is around $20 to $30. And then I'm also on a androgen blocker, which is another $12 per 3 months. So for me, with the amount that my insurance covers, it's not horribly expensive. But again, that's a monthly cost that a person who has multiple children and is living paycheck to paycheck may not be able to justify. This is the main reason that I think we absolutely should not judge anybody for the steps that they have or have not taken, in their transition, because you never know what's going on in somebody's life that could be leading them to avoid certain procedures. Talking about the financial parts of medical transition is really interesting because insurance also plays quite a big role in the amount that people are able to get done. People can get really different levels of coverages depending on what insurance plans they're on, but usually if a person is diagnosed with gender dysphoria, some insurance plans may cover certain procedures depending on which company you go with. Unfortunately, some insurance companies may completely deny coverage for anything transgender related, but most of them at least would cover hormones, and many of them cover bottom surgeries. Unfortunately, this really stems from the fact that a lot of insurance companies view a lot of the transgender procedures as completely being cosmetic, when in actuality they do have medical necessity for lowering people's gender dysphoria, but it really is, I guess, up to the discretion of that insurance company to cover what they want to cover. There really are great plans that do recognize the medical necessity of these procedures, and one example of that is Illinois Medicaid, which covers anything. If you go on the website and look at their coverage for trans procedures, it says that they don't put a limit on what they consider a trans procedure if the person can prove medical necessity, which is such an inclusive thing, and I think that having that option available for low-income people is so incredibly great. It just helps to solidify the idea that gender transition is something that is medically necessary for a lot of transgender people. No matter what any insurance company says about gender dysphoria, every single leading health organization in the world recognizes gender dysphoria and also recognizes that transition is really the only effective path to reducing gender dysphoria. So I do believe that in the future we'll hopefully see more inclusive things if things don't really continue to get worse for trans people in the current world. Let's hope for a better future, basically. Probably the most controversial topic in regards to medical transition is when or at what age a person should be able to access gender-affirming medical interventions. Again, there's such wide debate about this, even within the trans community. In general, a lot of people have the belief that children should have no idea about what being transgender is or anything about gender ideology because it could influence them to be trans, or that they might be groomed into being trans or influenced to hate themselves. When you break this down logically, it doesn't really make much sense. I was somebody that was never raised around any trans person. I still turned out trans. I literally knew nobody. I was from a small town, a small conservative town, and it wasn't until the age of maybe 16 that I'd heard about trans people widely. In my real life, of course, I had seen YouTube videos and stuff, as I had mentioned in previous videos, but I thought that was something like celebrities did, or that I didn't think that average people could transition, or that that was an option available to the average person. For me to still come to the conclusion that I'm trans after growing up in that environment, I think that kind of just disproves that point. And it's not just my story, but thousands of other trans people's story, that they never knew anybody trans growing up and they still turned out trans. So people are blowing this up to be a really, really huge issue, but in reality, the amount of minors that are receiving gender-affirming medical interventions are extremely low. According to the Turban 2022 study, there was a huge population of trans people in this study. I think it was around 22,000. And they found that of people who desired hormones and accessed hormones, only 0.6% of them were between the ages of 14 and 16, and 1.7% were between the ages of 16 and 18. This is 2%, y'all. This is 2%, and I'm not saying that those 2% aren't people whose autonomy and consent matters, but the hoops that these people have had to jump through in order to get the hormones that they need under the age of 18 was made with the consult of a doctor, a therapist, the parents, and the child. This wasn't something that the child was just thrown hormones and said, okay, good luck. This was something that the child likely had to go through extensive testing to make sure that they actually had gender dysphoria before accessing these hormones. And in case you're curious, about 56.8% of those people that desired to be on hormones were actually on hormones above the age of 18, and then 41% actually just ended up not getting hormones at all. The thing is, with access to these gender-affirming hormones, there's consensus that really starting these hormones has such positive mental health effects. And not only that, but starting them earlier actually increases the chances of having positive mental effects. And this has been proven in multiple studies. Again, the Turbin 2022 one, there was also Van de Grift in 2017. But if this small percentage of minors is shown to have positive mental health effects because of these hormones, I don't think that's a bad thing. Although this is debatable, and maybe this is just agree to disagree for a lot of people, but at the age of 17, you kind of understand things, right? And I'm not saying you have the full bodily autonomy of somebody that's a full-grown adult, but when you've worked with multiple professionals and gotten insight and consults from multiple professionals, you have the ability, the cognitive ability to understand the effects of the hormones that you're going on to, especially if you're going to preserve your sex cells like sperm or eggs. Again, most of the effects are reversible of hormones. So there's not too much bad that can happen as of right now that we know of for a minor going on gender-affirming hormones. Dr. Yoon, who is a certified plastic surgeon, author, YouTuber, he has a great video about medical transition, and he talks a lot in his video about puberty blockers. And I kind of want to go over what puberty blockers are. So, like the name sounds, they're really meant to delay the onset of puberty because puberty can have irreversible effects on a trans person's body that are usually going to cause a lot of distress for that trans person. So, for example, a biological male's voice deepening at puberty is something that would cause that person to have distress. And that's not something that's reversible later in life without the use of surgical procedures. And they're really only meant to delay it until the child gets a better sense of whether or not gender transition is something that they want to do. If they decide that it's not for them or it is for them, they can proceed correctly. In most cases, when a minor goes off of puberty blockers, the puberty onsets as normal, with very little to no adverse side effects from it. So should kids be given hormones and surgeries all willy-nilly? Again, what do you think the answer is? Myself and most people would say absolutely not. But the thing is that it's not even happening right now, like people make it out to be. Even children that do have access to any sort of gender-affirming care struggled to get access to that gender-affirming care because of the hoops that they have to jump through. And I'm not saying that's a bad thing that they have to jump through hoops. I'm saying that it exists. Those hoops exist for a reason. Those hoops exist to make sure that the children are making the choices with their parents and medical professionals that is best for the child. Many doctors have the mindset that gender transition that young is something that a person should not be going through unless it's found to be medically necessary. And so that's why there's so many professionals involved in the process. Surgeries are actually even more gatekept than hormones. And I don't have specific statistics on this, but I would go to say that most insurance companies and doctors would deny treatment to anybody under the age of 18 for surgical interventions. Jubilee, who you may be familiar with, has an interesting video where they have trans people and people that have detransitioned in a room discussing controversial topics. Something that I think stands out from that video is the well-founded concern that children do not have the cognitive ability to be able to accurately consent to medical transition, so aka hormones or surgery or anything like that. While this is a valid concern, I do think it is best to follow what nearly all of the major medical health organizations are saying is best, which is that with parental consent and a doctor and a therapist, it can be found to be medically necessary. And so I don't see a reason not to follow that. I will say, unfortunately, under the current Trump administration, a lot of the funding for research for everything basically has been cut. But this also includes research on trans people, and that is something that will probably negatively harm people's ability to access certain things. So finally, getting on to the point about reversals, and say I transition, and what if I want to go back? What if I want to go back to what I looked like before or anything? This obviously depends on what you've had done. Most surgical interventions are going to be completely irreversible. Maybe there's some that you could reverse with more surgeries. So like say you got facial implants for your jaw or chin or something, those could likely be removed. But something like top surgery, that's not something you're going to be able to really fix or remove easily without scarring. And bottom surgery is pretty irreversible because there's limited skin to work with down there. And so once you have something done, it's kind of done. And that may be scary for a lot of people, but I feel like that's why almost all procedures require a person to be on hormones and living as their authentic gender for at least 1 year before deciding to make any sort of permanent changes surgically. The effects of hormones, for the most part, can be reversible. For trans men, the only thing that's not reversible is the voice deepening. So if a trans man got to a point in their transition where their voice had deepened, that's not going back, similar to a trans woman. And for trans women, what's not going to go away if you cease the hormones is breast growth. That's something that would have to be surgically removed. But otherwise, your fat distribution and all the other things that I talked about in the beginning of the video, those can pretty much be reversed over time if you cease the hormones. For my last point, I want to discuss if a person's transition is always medical. And the answer is no. Not every single person is going to want to medically transition, and this can be for a wide range of reasons. Some people, it may just be as simple as some people not feeling dysphoric about the same things that other people are dysphoric about. Some people are more concerned with how they socially present, and so their genitalia has nothing to do with how other people see them on a day-to-day basis. I can wear whatever I want and present however I want, and I can choose to hide my genitalia, and nobody would ever know. And so that may not be something that a person opts for. Some people may not really want to take on the risk of complications or side effects of surgeries or hormones. That's another valid reason that a person might not want to. And another statistic from Dr. Yoon that I think stands out and would surprise a lot of people is that only 1 in 4 transgender people actually goes through with any sort of surgical procedures. And I feel like that just goes to show exactly what I said at the beginning of the video, where not everybody's transition is going to be that stereotypical hormones, top surgery, bottom surgery. That's really just not how it works among trans people, because a lot of trans people find a way to be happy with their body and also present the way that they want to present. Going back to the prices, people may not want to spend that amount of money on something that they may not even like the outcome of, you know? People may not feel like they live in a safe environment where they're able to come out or they're able to transition. I don't think it's fair to label these people as not trans, because at the end of the day, being trans just means that there's a misalignment between your physical presentation and your desired gender. That's that. It says nothing about whether or not you actually take the steps towards medical transition. So I don't think we should exclude people who are maybe in a situation that is worse than ours. Most interesting is that while a lot of trans people do feel that their gender identity is tied to the way that they physically present, some people don't feel that their gender identity is tied to their physicality at all. And for that reason, they don't really care how they present. It's just more so how they feel, which is just an interesting take to look at. If you're interested in more of these reasons of why a person may or may not decide to make the decisions that they do, Dr. Z, who I've mentioned in a previous video, she has a great video on the pros and cons. And so that is a good video to watch. I think that about wraps up everything I want to say about medical transition. If you are trans, I hope that you thought that this was interesting and you related to some of the things I said. If you're not trans or you're against trans people, I hope that you learned something, because that is the point of this video series, is to sort of destigmatize trans people, because we're going through a lot right now in the current state of the world. I think for people to not be scared of us and for people to not label us a threat, it's important to understand that we're human and we go through interesting experiences that are valuable and unique. With that, I hope to have another video out in the next 2 weeks, and I will see you probably in the next one. Also, final point, if any of you girlies struggle with frizzy hair, please leave in the comments down below some tips, because a girl's been struggling and I need to tame whatever's going on my head.